Our next speaker is Joseph Berardo, who is the president and CEO of MagnaCare that provides coverage for a lot of labor unions. And Joe, you're going to tell us how the new law is going to impact your business and how it's going to help you provide coverage to more union people.
I think I'll hit on some of that. Let me just start by saying MagnaCare is a health plan management company here in New York and New Jersey. We do not take insurance risks, so we administer the health plans for our self-insured plan sponsors. So I wanted to say that because I want to make sure that you understand that my comments aren't coming as an insurance executive. So let me start by saying, first of all, I think this is a bad bill. For the most part, from a social aspect, I think it's a great bill. Everybody should have coverage. Everybody should have access to health care. But as it relates to the way this was sold to the American people, it should have been sold in a way that we need to cover everybody. And by the way, it's going to cost a fortune. Because from my perspective, while John's a customer of mine, which is interesting, I hope he remains that by the end of the day.
We'll see.
But the interesting aspect, what we're charged to do on behalf of our customers is to help them control the costs within their health plan. I'm a new fan of HHC based on your last comments, because what this bill, in my opinion, on a big scale is missing is anything that's directed at the underlying delivery and cost of health care. Because if you look at what drives health care costs, it's got to do with the underlying health care. And in this marketplace, if you look at the consolidation of the hospital systems, we all talk about the consolidation of the insurance companies, but if you look at the consolidation of the hospital systems, we've created monopolies all over our great state here, where they in fact have the leverage. Now, if you think about the supply and demand of health care and how it's going to be financed, if we're going to have 15 million people join the Medicaid ranks, Medicaid is essentially almost unfunded as it is, as is Medicare. What happens is, as hospitals receive less from Medicare and Medicaid, they look to the commercial markets and they begin to raise the cost of care there. I watched the hospital executives hold hands and sing Kumbaya at the White House and talk about the fact that they're going to lower their cost 1.5% over the next 10 years. I returned back to my office the next day with 4 or 5 hospitals looking for 8 or 9% trend. So I'm really not sure where the connection is, but if you look at how private health care is financed, whether it's an insurance company, a self-insured health plan, or anybody in this room that's involved with financing health care, the underlying costs of this bill, at least in the near term, are going to drive insurance up. It's going to drive insurance up because of premium taxes. Insurers are not going to absorb the premium taxes. From the insurance regulation side, to build on the comments of the insurance department, we've had a guarantee issue state for the most part for 20 years, yet we probably have the most dysfunctional individual market on the planet. And the reason being is the people that buy individual insurance in New York are either really sick and they need it, or they're very wealthy and they want to protect their assets. Everybody else can't afford it. So the penalties, the surcharges, the $750 or the $695 that becomes the penalty over time if you don't buy insurance, is not nearly punitive enough to drive people into the insurance pool. If you think about guarantee issue covered with an insufficient penalty, if I'm the father of younger children, but if I have a son who's 27 years old and no longer covered, I'm going to buy insurance on the ambulance ride to the hospital for him. It's like buying car insurance from the accident scene from Geico. So if you look at the unintended consequences, again, I'd like to say from a social perspective, this is the right thing to do. Health insurance is broken. We need to cover more people. But if you look at this from the fiscal side of it, which is what my customers pay us to do, we fight very hard on their behalf to negotiate with providers, to build programs that allow them to provide coverage over time. There's really very little in this bill that addresses that near term. I'm hopeful long term that it will, and in fact it behooves companies like ours to work with hospital systems to start to think about how we can reward them for preventive care. We have a broken system where we pay way more for catastrophic care than we do for preventive care. If you look at your population, most people that have catastrophic claims, and by the way, 20% of your population is spending 80% of your assets. 20% of those people, about 3/4 of those people have not incurred a claim in the prior 2 years, which means people are not going to the doctor for their preventive care, they're not taking care of their chronic conditions, and they're driving claims costs. So over time, I'll leave with this comment, for us to truly reform healthcare, it's great to get people covered, it's great to get people in the system, but what we really need to address is how we pay for care. We can't continue to just pay for more. We have to pay for better quality. We have to pay for people to have their physicians engage them in managing their chronic conditions. And over time, hopefully we can bend the trend. But what I would like to see come out of the next iterations of this legislation, or here in the state of New York, which would be helpful, is rather than worry about the premium increase and get approvals for that from insurance companies, and by the way, that doesn't affect our business, so this is not a self-serving comment. I'd rather see the hospital increases, the increases that hospitals want to charge commercial carriers, everybody outside a government program, how much money they want to raise their DRG payments or their per diem payments should go to approval for some entity. Because when we had a regulated system here in New York in the late 90s on the DRG payment, we had a much more balanced, much more affordable system. So if you think about the free market in this marketplace, for the most part, has hurt us the most because we've allowed the provider side, and not so much the doctors, but the hospital side, to really drive what's going on the utilization front. So with that, I'll close. Thanks.